All right, so what I always say when I'm being videoed, whatever I say doesn't supersede what's in the manual. You should read the manual.
Disclaimer.
So, yes, exactly. So when you're done the procedure, we already rinsed the tip of the scope so that we wouldn't get a clog, and we blew out the excess water that was in the water channel by putting our finger over where the water bottle was and pushing down on the blue button. Then the excess water will come out, and then you'll just get air. That'll prevent clogs. And it's good to do that before you wake up the patient. So now you can hang the scope up, wake up your patient, come back for the true cleaning. So you don't have to have this hooked up. I just have it hooked up so I don't have to hold on to it. And I do this slightly different than what's in the manual. This cap is a soaking cap and it goes back on here, okay? And then you take your leak tester, and this end of the leak tester connects to that soaking cap and it locks on. Then you'll pump up that leak tester until it's in the blue area, and then that needle should stay put. If it starts to slide, that means either that's not on properly or there's a hole in the outer covering of the scope or in the channel of the scope. If that happens, you just wipe down the scope, give us a call, and we'll get it in for repair. But there's no leak in that leak tester, so in the scope. So we'll push and hold the button and release that pressure. Take off the leak tester. Now, this entire scope can be submersed in fluid, okay? So what you want to put it in, and I personally don't put this part in, but what you want to put it in is a neutral pH enzymatic cleaner. Okay, and we can recommend some different brands. This whole thing can go in, and then what you do is you suction some of the enzymatic cleaner up through the scope. So it'll go from the tip all the way through the insertion tube, through the handle, back out, and come out your suction tube. So I do leave it hooked up to suction.
When you say that whole thing, you're talking about the whole thing?
Yep, sure can.
Everything.
Yep, everything can be put in there. Okay, so once I suction up maybe a pint of that enzymatic cleaner, then I'll take off this red button. I grab it by the by the black rim, and I just pull it off. And often that's pretty dirty in there, depending on what your procedure you were doing. So you'll put that in the enzymatic cleaner as well, and brush it if it needs brushing. Then you take your biopsy cap, that comes off. There's 10 more of these in that case if you need them. That goes in the enzymatic cleaner. So now we have that port and that port exposed, and we're going to take a cleaning brush. Should have had this pre-opened for my video here. Do you mind opening this?